What is the first aid for hemorrhage control? Imagine seeing your pet suddenly bleeding from a cut or injury. It can be alarming, but knowing what to do immediately can make a big difference. When a pet is bleeding heavily, quick action is essential to prevent shock and save their life. The first step is to stay calm so you can think clearly and act effectively. Start by gently restraining your pet to keep them still and reduce stress. Place them on a flat surface in a comfortable position. If possible, have someone help you hold them gently but firmly. Next, wash your hands thoroughly and wear sterile gloves if you have them. This helps prevent infection. Identify the type of bleeding. Bright red blood that spurts with each heartbeat is arterial bleeding and is very serious. Darker red blood flowing steadily is venous bleeding. If blood oozes slowly from a wound, it is capillary bleeding and usually less urgent. Apply direct pressure to the bleeding site using a clean cloth, gauze, or sterile dressing. Press firmly but gently to avoid causing more pain. Keep the pressure steady and do not lift the dressing to check if bleeding has stopped, as this can disrupt clotting. If the bleeding is from a deep wound, gently pack the wound with sterile gauze or a hemostatic dressing, which helps promote clotting. Once the bleeding slows or stops, secure the dressing with a bandage. Wrap it snugly but not too tight, so blood flow isn't cut off. Elevate the injured limb above the pet's heart level if possible. Elevation helps reduce blood flow to the area and can slow bleeding further. In extreme cases where direct pressure and packing don't work, and if the bleeding is from an extremity, a tourniquet might be used as a last resort. Place it above the wound, closer to the body, and tighten it enough to stop blood flow. Remember, tourniquets should only be used temporarily and by someone trained as improper use can cause tissue damage. Watch your pet closely for signs of shock, such as pale gums, rapid breathing, a weak pulse, or weakness. If you notice these signs, get your pet to a veterinarian immediately. First, it is just a temporary fix. You need to get your pet to a vet as soon as possible for proper treatment, including wound repair, fluids, and infection prevention. Controlling hemorrhage quickly can save your pet's life. Focus on gentle restraint, applying direct pressure, packing if needed, and using a pressure bandage. Remember, professional veterinary care is essential for full recovery.